Hello and welcome to the 5-Minute Med Student, where we discuss important medical concepts in 5 minutes or less. Today we're going to be talking about conduction blocks, also known as atrioventricular blocks or AV blocks. First of all, it's important to understand the normal cardiac conduction pathway. Cardiac conduction begins in the SA node and then goes to the AV node, then to the bundle of His, then to the right and left bundle branches, and then to the Purkinje fibers. The SA node goes to the AV node, then to the bundle of His, and to the right and left bundle branches, and then finally the Purkinje fibers. There are 3 categories of AV blocks. There's a first-degree AV block, a second-degree AV block, which in and of itself is divided into 4 subtypes, and then a third-degree AV block. Finally, there is a bundle branch block, which, as the name implies, is a problem with the right or left bundle branches. This bundle branch block essentially represents slowed conduction through one of the ventricles and is often a result of some kind of myocardial insult, such as a myocardial infarction in that particular ventricle. A first-degree AV block is represented on EKG by prolonged PR interval but no missed ventricular beats. It essentially represents prolonged atrial conduction of the electrical signal, and no treatment is required as it is often asymptomatic. A third-degree AV block represents complete dissociation between the beating of the atria and the ventricles. Essentially, the atria and the ventricles beat independently of each other, and this block is at high risk for cardiac arrest or other serious decompensation. The 2 things to know about third-degree AV block are that it leads to escape rhythms. Escape rhythms can be ventricular, in which case the beats per minute will be between 20 and 40. This means that the originating electrical signal is coming from the bundle of His. These are represented by wide QRS complexes. Alternately, there can be a junctional escape rhythm, which is 40 to 60 beats per minute. This originates from the AV node, and this is represented on EKG by narrow QRS complexes. So ventricular escape rhythms are a little bit slower. They come from the bundle of His, and they have wide QRS complexes. Junctional escape rhythms are a little bit faster. They come from the AV node, and they have a narrow QRS. Finally, there's a second-degree AV block, which in and of itself has 4 subtypes. You have a Mobitz type 1, which is represented by progressive lengthening of the PR interval until a QRS complex or a ventricular beat is dropped. So you have progressive lengthening of the PR interval until there is a missed ventricular beat. The Mobitz type 2, you have dropped QRS beats with no change in the PR interval. This is essentially the atria are doing just fine, but for whatever reason, the ventricles drop out every so often. Also, there is something called a 2.1 AV block, which is represented by 2 P waves for every QRS complex. And there's also something called a high-grade second-degree AV block. This is more than 2 P waves for every QRS. So you have more than one atrial contraction for every single ventricular contraction. So in summary, you have a first-degree AV block, which represents prolonged atrial conduction, and it's represented by prolonged PR interval, but no missed ventricular beats. You have a third-degree AV block, which is represented by complete dissociation between the atria and the ventricles, and also has ventricular escape rhythms, which originate from the bundle of His and have wide QRS complexes, and junctional escape rhythms, which originate from the AV node and have narrow QRS complexes. There are 4 types of second-degree AV blocks. A Mobitz type 1 is progressive lengthening of the PR interval until a QRS beat is dropped. A Mobitz type 2 is a dropped QRS beat with no change in the PR interval. A 2.1 AV block is 2 P waves for every QRS. And a high-grade AV block is more than 2 P waves for every QRS. Finally, you have a bundle branch block, which represents slowed conduction through one or more of the ventricles. Thank you for listening to this edition of the 5-Minute Med Student.